Welcome to the Country Club podcast, but not the kind with dress codes and tea times. This is a different kind of country club, one where country living meets real estate, community, and adventure. I'm your host, Diana Cassidy-Bush, and your trusted guide to navigating life beyond the city limits. Whether you're looking to plant roots in a small town, find the perfect recreational escape, or make smart investments in rural properties, this podcast is for you. Because in real estate and in life, it's more than just about buying property. It's about making the right plan, seizing opportunities, and building a future you love. Welcome to the Country Club, where home, community, and opportunity come together. Hello, I'm your host, Diana Cassidy-Bush. Thank you so much for joining me at the Country Club podcast. I'm so excited and grateful that you're here. In our last episode, I invited listeners to send in their questions related to our topic, trading commute times for community. And Lisa sent this one in. Lisa asked, what's the best way to meet people when you work from home and you don't have kids in school? That is a really good question, Lisa. Working from home can feel a little bit isolating, so finding intentional ways to insert yourself into the local life is key. Look for maybe some co-working spaces, libraries, cafes, and sometimes there are office spaces that you can rent in small communities to kind of feel like you're in a bit of a hub. You could also take midday walk around the same time daily and see who you see and maybe try to connect with those people. Look for community-based groups or local places to gather. Look maybe some short workshops, maybe hobby that you're interested in, or if it's a business that you have, maybe look for business-based groups. A small weekly commitment can really open doors for you. And even one connection in a small community can open up your whole world. So great question, Lisa. Thank you so much for sending that in. And I hope that helped a bit. You got this. In today's episode, we're going to open up a discussion into a topic about your move to the country with some tips truly to thrive beyond city limits. The topic is about just what the doctor ordered, wellness and healthcare in rural Ontario. Joining us today is one of our local heroes. Please meet Dr. Charles Mustard, a dedicated family physician who traded the fast pace of urban practice for the meaningful connections and peaceful lifestyle of rural Ontario, who has proudly served the area for the past 19 years. Dr. Mustard brings not only medical expertise, but a deep understanding of the unique wellness needs and opportunities that come with small town living. In this episode, he shares his personal journey, professional insights, and practical advice for making the most of local healthcare resources and embracing a lifestyle rooted in balance, nature, and community. Welcome, and thank you so much for joining us today, Dr. Mustard.
Thank you for having me.
Yeah, it's great to have you. So hard to believe it's been 19 years since you moved to the area. That went fast.
It's shocking how fast it goes. I remember hitting the 5-year mark and feeling like that was a marker, and then all of a sudden it's 19 years. So it has been a great time in Tweed.
I wondered if we could maybe just start off with you maybe talking a little bit about how you were recruited and what that kind of process looked like then, and then maybe lead into what that sort of looks like now.
I've had a privileged career and lifestyle along with it, having worked. I worked up north in Northern Ontario in sort of fly-in communities, and I've worked in urban settings in Ottawa and Halifax, and certainly we were up north at the time, 19 years ago actually, and we had decided to take another run up to north. But then I had done a couple of stints in Tweed before, and we hit a sort of family crisis time, and we had sort of issues around aging parents, and we decided, my husband and I, we decided that it was time to move south and be accessible to our families and start to put roots down here after a slightly nomadic lifestyle, and so Tweed opened up, and it just presented the opportunity I want, and it's one of those kind of it's too good to be true. It just happened so easily, and it was such a nice fit for us as a couple, and for me as in my work. So it just was a kind of a things fell into place very easily, and we were extremely lucky.
How did you learn about the opening in Tweed? Is that because you had been in Tweed previously?
Yeah, one of the other docs. I'd been here and worked with one of the other docs, and I think he must have found out somehow that I was. We had stayed in touch, and he found out that I was there, and you know my colleague, and he is nothing if not persistent. So he was on the phone and quite persistent and encouraging. It was interesting. We had considered staying after one of the episode, previous locums that I did here, and we kind of, I'll call it, chickened out because we had reservations as a gay couple what it was going to be like to kind of live and work in a rural community, and and so we were a little bit older and in retrospect a bit wiser, and decided to forget about that, and this felt good, and let's just do it, and we've never regretted it. We've never had problems. Our fears that we had were kind of mislaid, and we really didn't have to worry about that. So my colleagues were knew I could do the job, and I guess they pushed me, and that worked out. Everybody was happy.
I know we're happy. You being our family doctor, all the help you've given us over the years.
Oh yeah, no, it's
Do you want to talk a little bit about kind of recruitment at this phase in, even in this community, what that looks like and what's maybe working there, what's maybe not working there?
we all know the stories about primary care writ large in the province, in the country, probably around the world. Just the changing landscape of it. Most of us feel like the future is in sort of development of team based interdisciplinary care, and to be quite honest, that's the kind of care that young physicians want to step into. They don't want to go to the small business model that in a sort of isolated environment that was kind of the norm of my generation of physicians when we first started out. And so, interestingly, most rural communities have had success in organizing that. Like if you look around our area, most of the rural communities in this area have developed, in our case, a community health center. Other communities have family health teams, and it very much feeds into that need. Now, it's still challenging to recruit people. The funding is there, and I can't say it's perfect, but I know I'm involved in a project where the province is putting some resources and putting some energy into improving it and trying to make sure that people get connected. It'll take a while to be perfect. Well, never be perfect, but it'll take a while to see the improvements. But certainly we're seeing progress, and I'm optimistic that we're going to see a marked improvement over the years to come.
Just some personal things about you. So what kind of surprised you most about practicing medicine in a small town compared to more urban areas?
What I referred to earlier, the concept of acceptance of diversity in rural areas. I grew up in a small town, and so I grew up in one of those small areas where all of my relatives were settled there within about a 10-kilometer radius, and so you kind of I brought some of that thinking of kind of an insular small town thing, and what I found here was that things have changed. People are much more tolerant of diversity, welcoming of people from outside the community, and so it really was a major difference. I'll admit the other things, like I think I expected it. Certainly, despite that change that we've seen, there is still a stronger community connectedness in a small town. So, that kind of has pros and cons, but mostly pros in terms of knowing that connectedness socially is a huge determinant of health. So, knowing that you have family, friends, other connections available is a part of staying healthy. So that certainly was a positive thing. That was a surprise. The third thing I'd mention is just the you know the family connections. I was trained as a family doctor, and I always say that I love the fact that I dealt with families, and that has its complications. But basically, you look after children, parents, grandparents, and aunts, uncles. You see all those connections in people, and so it's something you have to be very careful about because obviously protecting confidentiality, you have to build trust in the community that you're not going to sort of carry. You can deal with a couple divorcing and still provide good care to each of them, being very careful about confidentiality. So there's challenges to that, but the most times it's just wonderful because it's true family medicine, and that's what I was trained to do, and what I love doing.
When you moved to the area, was there an adjustment period for you personally, or professionally?
I was lucky because as a physician you move into a community, and you're kind of busy from day one. So of course you have to get used to new patients. You have to get used to new networks of specialists and tests, and how to get things done. So professionally there was obviously those usual challenges, but again you just sort of fall into it. I compare that to my husband, who was very different. He was coming in, of course, uh, without that kind of easy fit type of thing, and had to create sort of a network of people he knew, some projects that he wanted to get involved in, and of course he did amazingly well, and that's part of the secret of my success is that
I
he.
will say he did very well considering he's the mayor of the community at this point and has been very
Yes, I know.
all the way along. Yes.
Yeah, no, he got involved from. I think he first started on the library committee, and then got involved in another project and another project and another project, and then he was on council, and then he's the mayor. So it's sort of, but that's harder work than mine, where my role was fairly good. As I ease towards full retirement, I will have to try and learn from that myself. That I need to put myself out there to find things outside of work someday to to keep busy. But he's I think a good example of that sort of get out there, get involved. There's lots of committees, volunteer work, sports clubs, any number of things that you can get involved in that will then make the community experience ideal. And of course, for me, it was crucial because if he'd have been unhappy, uh, I wouldn't have been able to stay. So I was very pleased about that.
All right, we're going to switch gears and talk a little bit more about your thoughts on wellness and lifestyle. What do you feel that like wellness looks like in a rural setting, and how that might differ from urban approaches?
Myself, and I obviously I saw many people going through my exam rooms who were dealing with transitions from urban to rural, and there's no doubt that part of it is related to getting away from that high stress city living, going to a place where you can be across town in 5 minutes with no problem. Certainly the nature is a huge advantage in terms of wellness. There's almost a spiritual. I call it sometimes almost a spiritual connection to nature that people develop. But certainly that's it. We alluded to before, the challenge is, I think one of them is social connectedness, and to get in there and kind of make that happen. And that is also a huge determinant of health. And once you're in, once you sort of make the efforts, I've lived in the city too, and I didn't know who my neighbors were, and I could walk down the street and nobody would know me. And whereas in a small town, you soon get over that. You walk down your it's a little bit more of a fishbowl, but it's also much more connected, where you're connected to people on an ongoing basis. So the nature component, the social connectedness, and getting away from that sort of busy lifestyle or busy stress situation of the city are all things that I think contribute to wellness.
Excellent. So, how do you encourage your patients to take advantage of rural living to help support better health?
I think it's finding the balance. And I think the balance is fitting in activities and social connection versus ensuring that people stay active and sort of connected with nature, which is kind of why many of us come this direction in the first place. So I, for example, my husband's a fanatical gardener. He will meditate while weeding. I think it's the strangest thing, but he really does do that. So for people who do that, that's great exercise and sort of a connection to nature. I like bicycling, and to me that sort of fits some of the thing. But you have to find those opportunities and find the balance between getting out and being connected and stuff. Obviously, making sure to build in exercise and all the other important things determining wellness. But from the rural perspective, I think that building those opportunities for connectedness and also the connection with nature are unique opportunities here that you might not find elsewhere.
So, what kind of healthcare services are available in smaller communities that people might not expect?
The interesting part is, I think, as I alluded to earlier, the idea that most small communities in this area, and I think this speaks somewhat across the province, have come together. And like in Hastings County, where we are, for example, I don't think there's any independent physicians outside of. There's a couple in Belleville, but in the rural areas of Hastings County, people have come together in clinics, and those are team-based interdisciplinary clinics, and so I think you'd be surprised at the organization of it would be the thing that would be most surprising. And I think the rural areas, it's still not good enough, but there's quite a number of young people and really quite excellent physicians that are there. So that's unique. The other part, I think, and this is part of the appeal for me as a professional, is there's an element of comprehensiveness in rural areas that's maybe a little different than the city. So, as a simple example, I think of diabetes, and I sometimes hear of people like who are referred to their endocrinologist for management of their diabetes, and I sort of shake my head because we should, in my mind, we should save the endocrinologists for the difficult cases. We can access endocrinology for difficult cases, but here in rural areas, the family doctors or the primary care providers really need to sort of take responsibility for some of those things that in the city might be farmed out to specialists. So there's a slight difference in some of that balance between primary care providers and the specialists. Some of that is because of relative scarcity of specialists. Part of it relates to distance. For example, our nearest endocrinologist is really in Kingston, so the distance is a deterrent. But mostly, I think it's just good practice because I want to save the endocrinologist. I want to save the specialists for the complicated patients, and then when they solve the complicated problems, they send the patient back to me. So there is a slight difference in that way too.
I find it really great in a small town that we also have, not just the gateway healthcare community, but we also have things like physiotherapists, chiropractors, massage therapy, and different kind of support systems right in the small town. I'm sure you refer a lot of people that are facing surgery or recovering from injuries off to the local physiotherapist.
It's essential. Certainly, we're very lucky here because we have good home care coverage. Our primary care team has some services like social work and dietitians and respiratory therapists that allow us to improve quality and yet it coordinated closely with the primary care provider, the physician or nurse practitioner. So it's good that way. I don't think there's a real some services we end up using Belleville, which is half an hour away. But in general, the allied health services are quite accessible, and I'm quite impressed by the quality of care that we do get from the various allied health professionals, and and it's quite a respectful relationship between the family doctors and the and various allied health professionals.
Excellent. So that would be great for people here, of all ages, basically children right through to seniors and all the care that's required throughout the different phases of people's lives.
I don't know if it's a nicest term, but we talk about cradle to grave care, and we feel that our patient is our patient before they're born, and we care for them until the end, and until the end of their life, and in most cases we can manage them through that end of life experience, and in many cases with family support, like lots of family support, which some people have, is and with the guidance of what we do and home care. So we have that kind of comprehensive lifespan care that I think is hugely important. We are quite respected. Sometimes we need help, and even in the case of a homebound patient, I can dial a specialist and say I'll pick on palliative care, for example, and I can dial up a specialist in Kingston, and they will be quite respectful of my role and guide me through a complicated situation if the need arises. So there's certainly support there, but the key is that we want to provide full lifetime care for people, uh, with the support of all the allied health professionals, and whenever possible with the support of families. And I think we all know that family support can be crucial to managing various health issues.
Yep, know that one from personal experience.
I think many of us do. Yeah.
What are your thoughts? Like, what should newcomers know about accessing family doctors, walk-in clinics, or specialists in the area?
Yeah, I think the first thing is to connect with your local clinic and see what options are available there, because attachment to primary care is the ideal. If that's and as I say, I'm optimistic that that's going to improve, and that Dr. Jane Philpott, who's uh, heading up a primary care action team in the province. She aims. Her goal is that you move to Tweed, you'll be automatically hooked up to the local health clinic, in the same way that your child would be hooked up to the local school. And so I think that's coming, and it's a realistic goal, but we're not there yet. But attaching to inquiring at the local clinic is sort of the first place to start. Lots of people end up transitioning with their previous family doctor. I was the same when I moved here. We had a wonderful family doctor in Ottawa, and really liked him and hated to give him up, and then but finally we said, oh, that's stupid. We need to transition to a local family doctor, and now we have a great family doctor near here. I went to Belleville just because of the privacy issues, but it's there. There are other things to tide you over other than the emergency department. There's some virtual clinics. The walk-in clinics are kind of iffy in a way, but there's some virtual clinics that sometimes people can get. But sadly, I know that the default is some people have to go to emergency, and for things that shouldn't be emergencies, and so that's unfortunately become our safety valve, is through the emergency department. So anyway, I've been around for 40 years and doing this job, and I feel like it has changed, but there will be future changes. I'm still optimistic, but I do know that it's can be a challenge for people.
Understandable. Yeah, things take time. Change the old ways.
Part of my 40 years is to say that things have changed. Like when I started, nobody worried about cholesterol, and diabetes wasn't. We didn't have as many tools to manage diabetes. So this whole aging population, the increased opportunities for intervention into chronic disease management, changes in electronic use of electronic medical record tools, various reasons. The world of primary care has changed immensely in 40 years, and so it really has forced us into changing our approach to it, and I just hope that we're on the right direction now.
Good. I hope so too.
Yeah.
How do you find the patient doctor relationship, how it differs in a small community?
It's more frequent, I think, in this in a small community like this, that you'd get a true talked about earlier, the idea of a true family experience, that you'll have uh, family, whole families and multi-generational representation of families in the same practice. And I think that's, again, the joy, but it is complicated. But once you start to put the pieces together, it's always surprising. Once in a while, you get somebody come in and you realize that they're grieving because the patient that you looked after a few weeks ago died, and all of it sort of falls into place in a way. But you have to be careful too, and certainly I can tell you the uh, my husband and I have a unique situation where I learned very early that I have to shut down when I go home because there are things that I know that he can't know. And now that he's mayor, especially, there's things he knows that I can't know or I don't want to know. And so there's certainly challenges that are slightly different in or slightly more important in a rural setting than there would be elsewhere. But most of it is the joy of being a true community physician and being, and to be honest, to be respected as that too. It's a very rewarding thing to think of looking after uh, other family members and sometimes making a difference. So
Absolutely. Making a big difference for people. So, back to you as a professional, how do you personally find balance and wellness while living rurally?
I'm in the process of scaling back a little bit, and so I've been uh, and I will admit that I've been a workaholic for 40 years, and old habits die hard. But the certainly for me, it is family and friends and are important to me. It's always a little tough building social connections in a small town because you have to be a little guarded because of my role in the community. So there's always a little bit of that. But I have family and friends who are loyal to me and very supportive, and that's been important to me. As I say, I try and get some exercise with biking. I love my little Zen space is sitting, uh, reading a book, and the we built a screened-in porch, and we have can lie down and read a book and listen to. We have a couple of water features, which, by the way, were built 18 and 19 years ago by none other than Diana Cassidy-Bush. In her previous incarnation as a landscaper. But I love just sitting up there, and we have very good privacy. My husband's gardens are lovely, and that's kind of my space to chill and kind of connect a little bit, almost a meditative type experience. So I have little ways to do it. It's certainly as I sort of scale back a little bit of work, I'm catching a little bit the bug on gardening, and certainly we also love traveling, and we have been blessed with many interesting opportunities to travel, and so that's been good. So while my colleagues in Toronto are paying for mortgages for years and years and years, we're spending money going to exotic locations and enjoying that. So
Yeah, that's definitely worth noting. Well, thank you so much, Dr. Mustard, for sharing what it's like to navigate wellness and healthcare in rural Ontario. We really appreciate you sharing your own personal story about your move to the small town and some of your myth busting experiences as a gay couple moving to a small town. That was very personal, raw, and real, and we really appreciate you opening up and sharing your insights on that, and insights into the real state of rural healthcare and how residents can take full advantage of local resources to live well. We certainly have been so blessed to have you as part of our community, and we thank you for sharing your thoughts, experiences on building community and finding balances, and this episode is one people will not want to miss.
Well, thank you, Diana. You are a very important part of this community too, and we think of you daily when we sit listening to our water features there, our whole landscaping and all that. So I know it, but as a real estate agent, you've been a great asset to the community as well.
Thank you so much. I really appreciate that. I want you to take a couple of minutes to digest what we covered in this episode, and please send in your questions about wellness in a small town or rural living to help us shape the conversation about you and your real estate journey. Send it to us via email, through social media. We would love to hear from you. Till next time, thank you so much for joining us on the Country Club podcast, and can't wait to see you next time. Thanks for joining me at the Country Club today. I hope our conversation has helped guide your journey. Whether you're looking to plant roots in a small town, find the perfect recreational escape, or invest in rural properties, every situation is unique, and I'm here if you need a trusted resource on your real estate journey. As always, consult with a qualified professional before making any investment decisions. I'm Diana Cassidy-Bush, and I'll see you next time with more conversations about thriving beyond the city limits. Click the follow button for the Country Club podcast with Diana Cassidy-Bush on your favorite podcast platform, and let's start building your future together.